Hi everybody, Joel Palmer here at Vintage Fitness. Today's video is especially for those people who suffer with lower back pain and hip pain. In particular, if you suffer from pain across the lumbosacral region, maybe back here over the sacroiliac joints, people who get problems across the top of the pelvic rim here and down along into the sides of the hips. So if you're somebody who gets hip, SI, low back pain, iliac type pain, one of the leading causes of all those problems are imbalances in the pelvic stabilizing musculature. So I'm going to show you a couple of easy things you can do. I'll show you a few variations of things, stuff you can do right at home or in the gym. You can make it part of your regular routine and see if you can start rehabilitating your own dysfunction. Okay, so here's exercise number 1. It's good to have something as a target to use. I'm going to show you a version using, this is just a foam roller, but it could be whatever. You could use a kettlebell, a medicine ball, you could stack a couple of books on the floor. It doesn't need to be anything fancy. This is called a standing step over and back. This is a step over and back. So what you're going to do is you're going to start with your right leg. You're going to keep the left leg planted. There's going to be a moment in time where you have to balance on that left leg. The idea is to do this slowly, not quickly. Nothing herky and jerky, very controlled. Part of the challenge is to maintain your balance and maintain your pelvic alignment. So you're going to see that in a second. The foam roller is just a tool to step over and back out over the top of. And so here's how it works. I'm going to start with my right leg. We're going to keep the left leg planted. Right leg on one side of the foam roller. We're going to just pick that knee up slowly, step over, step on the floor on the other side. Now we're going to come back. So it's a step over and a step back. So step over, step back. In the beginning, keep it low, especially if you're already having some back or sacroiliac or hip pain. You might not want to step too high, but as you get stronger and you feel more confident, your balance feels better, you can start trying to pick that leg up a little bit higher. So in the beginning, maybe I'm just getting over the foam roller. Boom. So over and back is 1 rep. Okay? You could easily do sets of 10 to 12 reps. As you get stronger and feel more secure, you might want to start trying to pick this leg up a little higher and step over and step back. Okay? If you really want to start challenging yourself, then you can take that foam roller, you can stand it up on end. Now your target is certainly much higher, little tougher to do. Boom, you see the balance challenge right there. Pull it over and back. So step over, step back. Okay? So step over and back. Sets of 10 to 12 reps. Remember, do one leg for 10 reps. Switch over, do the other leg for 10 reps. I do 2 or 3 sets. Perfectly fine for getting you started. If you feel like you're a little wobbly, put yourself somewhere where you have something to check your balance, close to a wall. Here I'm using the kettlebell rack. You could use a body bar if you need to. Ultimately, you want to try to do it without your hands because it's going to challenge you more. But if you feel a little wobbly, put a hand on something and just be close by. So if you start to wobble a bit, you can put your hand out. So if you were closer to the wall, you could do it closer to the wall if you needed the wall to help you. Okay? As you're stepping over that, the leg you're actually moving, so in this case the right leg, we're working hip range of motion, we're working some hip flexor work here, some hip abductor work. As you step back, we're hitting the inside of the hip more, so more of the groin and the adductor muscle group. And the foot that's planted, because you're on one foot, the muscles across the top of the pelvis, the quadratus lumborum, the outside hip muscles like the TFL, the glute medius, they all have to work very hard to keep your pelvis stable. As you get stronger, you'll see that your balance is better, and part of it is because your hips won't collapse under you as you try to come through this move. So the idea is to try to stay very stable. It's not a big, quick motion. It's slow and controlled. Step over, get yourself planted, feel safe and secure, step back. Okay? Okay, exercise number 2, hip hikers. Hip hikers. Again, we're going to work on the muscles that come across the top of the iliac rim, help to keep your pelvis nice and stable, support your sacroiliac joints, support your hips. So a hip hiker is simply, as we hike the hip, it's nothing more than sort of raising one side up, okay? That will work the hip hiker unit. And a nice way of doing it is on a small step. So you could do this at home on actually a step in your house, or if you've got a low step-up box. You don't need a big high plyo box to do this. Again, if you had some boards at home or something, you can put that up. It's just something nice to get you off the floor a little bit. So what we're going to do is we're going to stand on the edge of the platform. My free leg is the one we're going to hike. So we're going to let it collapse a little and then hike it up. Collapse a little. You see I've got a little bit of a bent knee on the planted side. That's okay. And then you're going to hike that hip up. So it's not a big, high motion. We're just letting the pelvis drop on this side and then pulling it up on that side. Drop and pull up. Okay? Same kind of thing as the last exercise. Do sets of 10 to 12. So you can do 10 repetitions on the one side, step to the other side of the box or turn around, what have you, and then do the other end. Hike that hip, hike it up. Okay, 2 reps, right? 3 reps. Again, don't go too fast. And if you feel a little wobbly at first, which is natural, again, when things are weaker, you're going to feel a little more wobbly because they're not working as well, they're not supporting you like they should. So what you can do is, again, check your balance, do it close to a wall if you need to catch yourself. Or if you're doing it on a step at home, you might have some railings, that you can use to hold on to. Or again, you could use something like a body bar. The only thing I advise about something like a body bar is don't allow the bar to become your crutch. Ultimately, if you're really going to strengthen these weak muscles, they need to be able to function without you holding on to something. Something like a wall, I find people are a little less apt to cheat with because it's not right in their hand. They just reach out if they start to topple a little bit just to correct themselves. Okay, so keep that in mind. Okay, so planking is a great way to build all your core strength up, and a really good way to help strengthen your lower back. In particular, with people with hip, sacroiliac, iliac type problems or pain in those areas, the side plank is king. Just mastering a side plank is helpful, but I'm going to show you a few variations here just to give you some options. So if you're at the very beginning stages and say either your back is very sore, you're recovering from an injury, or maybe you've just never done these before and maybe you just don't have the strength or you haven't coordinated it just yet, you can do the basic side plank from your knees. Okay, so we're going to shorten your lever system, and the way that looks is you just take your knees and bend them, right? Forearm on the ground. We're going to do these in the low position, and we're just going to plank up. And in the beginning, if just that is difficult, you can use your offhand to help you a little bit. You can also pulse it and not hold it for very long. So what you might do is pulse out 10 repetitions, right? Or you can use your hand here to help pulse out those 10 repetitions, okay? The next version gets a little harder, is in the full elongated side plank position. Now we're gonna balance on the, in this case, my right forearm and the edge of my right foot, and boom, full on side plank position. What you do with this, hand's up to you. Some people like it up here, some people leave it right here. Again, you can use it as an aid if you've mastered this one from the knees and you're able to hold that, especially if you can hold it statically for say 30 seconds. I would say move on to the elongated version. And then from there, you can go from pulses. In the beginning, pulses, maybe use your offhand to help you, or just put it on your body or stick it overhead, right? Once you can pulse out, 10 reps, then maybe start working on holds, hold times. I like 30 seconds. 30 seconds on, roll over to the other side, do another 30 seconds, do each side 2 or 3 times, boom, done. Okay, so bang, set your timer on your sports watch or your interval timer, give yourself 30 seconds, beep, beep, right? We turn to the other side, pop up, another 30 seconds, maybe do that 2, even 3 times through. Beyond that, the next thing is to add a lateral leg raise. So what we would do next is pop up in that side plank and now start trying to raise that leg. So what I like to do is, again, sets of 10 to 12 reps. 10 reps. So you'll stay up in that plank. You'll knock out 10 controlled reps. When you're done, come down, turn to the other side, repeat it on the other side. 10 reps on the other side. Again, do 2 to 3 sets, depending on how much total work you're going to be doing. So that takes you through some stages of side planking. But side planks are great. They force you to develop the strength in the lateral stabilizers of the lower back, and especially those muscles that help to stabilize the pelvis, like the TFL, the glute medius, the quadratus lumborum, okay? These things are what we need strong in order to maintain good pelvic alignment. And even if you're going and getting good treatment, say you've had an acute injury, even with all the good acute treatment, whether it's physical therapy or chiropractic or osteopathy or what have you, the fact is, once they get you aligned well, now your body has to develop the strength to maintain the alignment. So ultimately, you got to get stronger, okay? So work on these and hopefully we'll get you there. Okay, so the next exercise is what I like to call a dragon lunge. It's another great one, especially if you've got like iliotibial band issues, ITB syndrome. Again, helps to build the lateral hips, the stabilizers of the pelvis. It's basically a reverse lunge, but the back leg crosses past or beyond the center line. So the way it looks is this way. We cross that leg back and drop into our lunge here, okay? So from the side, the way it looks is you step back and you cross. Dragon lunge, you step back and you cross. It's important that the back leg actually crosses. Stepping straight back will not challenge that ITB in the same fashion. It won't challenge the lateral stabilizers in the same fashion, so it's important that you step back. So again, dragon lunge, right here, step back and cross behind. So step back, dragon lunge, boom. When you come up, come all the way up, lock it out. Squeeze your butt tight, squeeze your core tight, okay? If you want, you can add resistance. Once you've gotten good at just doing it in the body weight fashion, a lot of times we'll hold the kettlebell up in that front squat position and dragon lunge with the kettlebell. That's 1 rep, 2 reps, okay? Again, same kind of rep range, 10 to 12 reps, each side, 2 to 3 sets. Again, it depends on how many of these exercises you're going to group together. Remember the cumulative effect. If you're really doing these exercises for rehab purposes, my suggestion is you can take them and even break them up. Don't necessarily do them all at once. Maybe take 2 or 3 of the exercises, do them on one day, and the next day you do your rehab. Take 2 or 3 of the other ones and do those on a different day. So just break it up. You don't want the sessions to be too long. If you're looking to really do focused sort of rehabilitation kind of things, I like to keep it around 15 minutes max, and then you'll be apt to get them done. Otherwise, if the sessions get too long, it gets hard to work it into a busy day, and then you start skipping them, and then that's no good. Okay. All right, next exercise. Again, we don't need any tools. This one you can do right in your living room, easy peasy. All right, this is a version of a duck under, and if you've ever taken any kickboxing classes, you probably have done some duck unders. Basically a duck under, we duck under, it's like ducking under a punch. You duck and you slide typically. Duck and slide. Okay, so you're getting a little bit of squatting work in there, and getting a little mobility work as well. We're going to tweak it a little bit by turning it into a duck under with a pivot. So the trailing leg is going to pivot a little bit. So you squat and duck under, start to slide, and then pivot as you come out. Duck under, pivot. See the back leg pivots. Duck under, pivot. Duck under, pivot. Duck under, pivot. All right, one more time. Duck under, pivot, duck under, pivot, duck under, pivot. Again, I like to count just 20 total. So you're getting 10 on each side basically, right? So it's duck under, that's 1, duck under, pivot, that's 2, duck under, pivot, that's 3, okay? Duck unders and pivots, easy one you can do right in your living room. Throw that one into the mix. All right, gang, I'm going to give you one more here. Unilateral, or one-sided, carries and holds. A fabulous way to stimulate those stabilizers of the hips and the pelvis. Okay, so this one you do need a tool. You'll need a weight. It doesn't necessarily have to be a super heavy weight. Pick something in the beginning, especially if you're rehabilitating an injury. Don't go too heavy. Start at a reasonable fashion. Kettlebells are great. This is where kettlebells have a great advantage just because they come with a convenient handle, okay? If you don't have that, you could also use a sandbag with a handle, or throw some items in your gym bag and give it a little bit of weight, or you could use a 1-gallon water jug or an old milk jug that's got a handle. So just something to kind of stimulate the firing of the stabilizer muscles in the lower back and pelvis. So here we're going to start. Here's the simplest drill. The simplest drill, and this is a pet peeve of mine. I want you all to pick it up correctly. Don't bend over at the waist to pick up your weight, okay? You need to squat down to get it. Keep your spine supported. Don't just hunch over and pick it up, okay? There's no point doing a drill if you're going to ruin it by bending over incorrectly and just wrecking your back. Avoid that, please. So here's what we do. We suitcase deadlift it to start with. So we're down here at the side, suitcase deadlift it, and now we're just going to hold it. And while I hold it, I'm squeezing. Squeezing my abs tight, my quads are tight, my glutes are tight. Everything is tight. Now you can hold for a period of time if you wish. Start with 20 to 30 second holds. Maybe eventually work up to a minute. After a minute, I like to take a break anyway. I think a minute is plenty for most people, especially if you're going to do multiple sets, okay? When you return this thing back to the ground, you do it correctly. You squat it down and properly suitcase deadlift it down. Don't just bend over, okay? Please avoid that. Bending over, particularly bending at the waist in combination with twisting, is the #1 way most people wreck their backs, okay? So be careful, all right? So that is a suitcase deadlift or a suitcase deadlift hold. You can certainly just do suitcase deadlifts. Also a great way to do this. So it's a little bit more mobility. You'll get more leg work as well. So you can knock off 10 reps of just suitcase deadlifts, but lock them in at the top, don't rush them, okay? So lock them in means when you get to the top, squeeze your butt tight, squeeze your quads tight, squeeze your abs tight, then return it. That's 1 rep. That's 2 reps. 3 reps, right? And you can go up to 10 reps and then switch to the other side. Again, 2 or 3 sets total. If you want to take it just a little bit further, the next thing is an offset carry. So we're going to carry this. This is the traditional farmer carry. So holding the kettlebell on one side. Again, the weight is going to want to pull you to the side you're holding it, right? You've got more weight on the right, so it's going to want to pull you there. So your back has to develop the strength to maintain that posture. So again, as you carry, you want to try to keep a nice tall posture. Try not to flex forward. Try not to allow the weight to tip you too far to one side. If you find that the weight is constantly tipping you to one side and you just can't straighten it out, then you probably should lower the weight. Okay? So a farmer carry will look like this. We're going to start with a suitcase deadlift. Boom. And then we just walk. Okay? Just walk. Find yourself a distance that's comfortable. Get to one end. Walk back to the other side. When you get to the end, set it down properly. No bending. Set it down. Then you'll step over and you'll carry it on the other side and do the same thing. So if you've got a nice long hallway, you can certainly do it for a nice stretch. And if you've never seen the length of our studio, shoot, there you go. There you go. Nice long hallway. So when we do our carries here, we start at one end, we go to the other, and we come back. And again, you can do that in sets of 2 or 3. Okay, sets of 2 or 3. There you go. Thank you, cameraman, for the professional work. Okay, so there's, what, a half a dozen exercises that you can do. They're non-traditional. They are creative. They're incredibly functional and effective. Remember, if you are an acute back pain patient, you have to get over the acuteness first. You can't start with these things. You've got to do some other things. My recommendation, if you're going to do any kind of exercising in the acute phase, everything is done to tolerance. Don't try to push through the pain. Do things to whatever level you can do. Stretching is almost always contraindicated, meaning stretching an acute low back is a bad idea. It activates the stretch contract reaction and throws you into greater spasm. Only feels good temporarily. Once you let go of the stretch, things seize up even more. You make yourself worse. So what you want to do is mobility kind of work. I've got a video on my channel. Go check it out. Go to YouTube. It's called VFSV, Simple Home Low Back Exercises. Go try those out. Do them to your tolerance. Do them as best you can. Once you get through the acute phase and you're no longer hot, swollen, inflamed, spastic, now you got to start correcting the problem. Now you have to start re-strengthening. And remember, when you have an acute back injury, you've damaged fibers. It's going to take a little time to not only heal, but to also rehabilitate. And just because you get out of pain doesn't mean you've rehabilitated completely. You need to get strong. These should all be things you should be able to do routinely, like that. If you can't, it tells you that you are weak in places that you need to work on. Once you get these all mastered, and you want to do stuff that's a little more hardcore, I've got a couple other videos up on YouTube. You can check it out. I have a tutorial on kettlebell swings, a tutorial on kettlebell cleans. There's a tutorial on kettlebells and low back pain, where we go over proper deadlifting form. So those things start to get a little more intense, a little more aggressive, a little more structured, and you can check those videos out as well. Okay, so hopefully some of these things have helped. At the very least, take these half dozen exercises, as I said earlier, maybe do 3 on Monday, and then maybe the next day you work your low back rehab, maybe Wednesday say, do the other 3 and rotate them around. Eventually you're going to find the ones that feel like they are the most effective for you. You can focus a little more on those, but try to master the 6 exercises and get good at all 6. So hopefully this helps you, and hopefully some of the other videos will help you. Check back with us. I'm always putting up new stuff, trying to give you some ideas of ways you can take care of your own injuries and your own deficits. So keep tuning in to our YouTube channel. And remember, life is heavy, train for life. We'll see you back here next time.